Have you ever wondered how secure or insecure a person is who has narcissistic personality disorder? Well, it's not uncommon to hear narcissism and narcissist used casually to describe people who seem vain and self centered, who seem to care only about themselves, who demand attention, admiration, and respect, who exaggerate achievements, or who and manipulate others for their own purposes. While these traits are all associated with narcissistic personality disorder, people with just a few of these traits may not necessarily meet the criteria for diagnosis. What's more, other significant characteristics of narcissism are often less recognizable, so they aren't always associated with the disorder. It's also important to note that it's generally a good idea to avoid labeling people with mental health diagnoses when you don't have a full picture of their mental health. But it is true that people with the traits of narcissism generally show a mask of superiority and arrogance to the world. They may seem full of themselves, they may demand appreciation from others, and appear to have high self esteem. But an inner core of insecurity often lies behind this mask. According to the DSM 5, the Diagnostic and Statistical Manual of Mental Disorders, people with this disorder almost always have a fragile sense of self esteem. And because of this, they spend a lot of time thinking about how others perceive them and how well they're doing in life. This insecurity contributes to the continuous demand for admiration that's associated with narcissistic personality disorder. Many people with narcissism struggle with pervasive feelings of insecurity that are underneath their outward superiority and entitlement that they present to the world. But this experience may be most commonly associated with covert or what we might call vulnerable narcissism. Many people with this subtype of narcissism do show outward signs of sensitivity to criticism and insecurity. And this insecurity, often tied to the contempt of being less than perfect, can contribute to mental health concerns like stress, anxiety, and depression. So, this insecurity can manifest as difficulty accepting criticism or anything that is seen as criticism. And since critiques can trigger feelings of vulnerability, this is particularly likely to happen in someone who has those feelings of vulnerability. Someone with narcissism may, for example, take constructive advice from a supervisor as a personal attack and then react angrily. They might offer a reply that is filled with contempt, or they may make a passive aggressive or mocking comment. This reaction, lashing out in response to a slight, can then humiliate or reject the person who's offering the critique, which of course can significantly affect relationships, whether it be at work or personal relationships. So, people with narcissistic personality disorder generally do this to help relieve the potential threat to their self esteem. So, this disorder is a complex personality disorder that involves feelings of insecurity. But insecurity is not only linked to narcissism. It's not uncommon to feel insecure or to struggle with moments or longer periods of time of having lower self esteem, even if a person has no mental health diagnosis at all. One way to differentiate narcissistic insecurity involves looking at the person's response to perceived criticism or other threats. Responding with aggression, rage, or passive aggression could suggest narcissism, but again, this is not a definitive diagnostic tool. Existing research on narcissism suggests that people with this disorder do tend to feel insecure, whether they display this insecurity outwardly or not. Insecurity may provoke many of the problematic behaviors that are associated with narcissism. People with narcissistic personality disorder generally feel unworthy, ashamed, and empty, and then they hide this emptiness from themselves and others. Maintaining a relationship with someone who has this disorder can be very difficult. People living with narcissistic traits may have had a parent who has had this disorder or currently does, and they may have experienced insecure attachment as a child or have other attachment issues. It's also not uncommon for people who are living with someone who has this disorder to experience depression themselves and to experience anxiety. And the person with this disorder can also experience these things. They may also experience suicidal thoughts or abuse substances. These can all lead to relationship difficulties, though dealing with the main traits of narcissism may pose the greatest challenge. People with narcissism generally need a lot of admiration and approval, since receiving this admiration may help combat the underlying insecurity. But because narcissistic personality disorder typically involves a lack of empathy, they don't usually offer much in the way of reciprocation. This is one key reason why people living with a person with this disorder often will see that person with the disorder as being toxic. That person with the disorder often needs their romantic partner to praise them, to listen to them, talk about their feelings and topics of personal interest. They may demand devotion and regard, and they might talk about their envy for others or project those feelings by talking about how others envy them. This can be very draining for romantic partners and family members of people with this disorder, especially because people with this disorder may also express insecurity by accusing their partners of being unfaithful, not caring about them enough, or not doing enough for them. And they might use emotional abuse tactics, including gaslighting, to try and control their partners so that they'll remain in the relationship and continue offering admiration and regard. These attitudes and attacks can cause a lot of emotional pain, and they can lead to feelings of insecurity in anyone involved with a person with this disorder. For more information on narcissistic personality disorder, I've provided some helpful links in the video description.